Hello everyone, welcome to today's video. This is Dr. Abinaya Vijayakumar, a doctor and a motherhood empowerment coach. Today in this video, we are going to discuss how to have a healthy pregnancy. Let's get started. So first and foremost, when we talk about having a healthy pregnancy, there are few doubts that the mother commonly has and few risk factors which has to be addressed immediately and few other myths related to pregnancy. So let's decode one by one. What are all the common doubts that the mothers have? So first, how can a mother keep herself healthy? You need to concentrate more and more towards having a healthy nutrition in place. It's not that you're going to eat for two. That is a complete myth. But you need to have a balanced diet in place every single day in order to meet the needs of you as well as the growing baby inside you. You can hire a nutritionist if possible. Otherwise, you can take a balanced diet where you eat lots of veggies and fruits and cut down on carbs like rice. You need not go zero on carbs, but you can take a reduced portion of it. Along with it, every single day include nuts, fruits, vegetables and egg if possible. Don't forget to take your prenatal vitamins without fail. Every single day, make it always your priority that you don't miss on any single dose of prenatal vitamins. Second, can a pregnant woman travel? Yes, of course, you can travel. What is the ideal period in pregnancy? If you ask about it, I would always say 14 to 28 weeks, because less than 14 weeks, if it is, because it is your first trimester, there is always some complications or risk involved, and post 28 there is always a risk of preterm labor and abruptio placenta and all that. But anywhere, if you have a normal healthy pregnancy with no challenges, no IUI or IVF treatments, you can travel, but the ideal period would be between 14 to 28 weeks. What if you are planning an air travel? You need to check with the air travel agency, because many of the agencies have their own policy. They don't board the pregnant mothers after certain weeks, especially like post 35 weeks, 36 weeks. So you need to check with that earlier. If at all you're traveling by air, try to get a seat with more leg space so that you can stretch your legs and you can walk in between whenever possible. If it's a long flight, that is very important. And if it's by road, try to take breaks in between where you can get out of the car, walk for a few minutes or stretch your leg. That would prevent the blood clots forming in your legs during the travel. Third, why am I getting back pain often? Why are you getting back pain? This is because of the stretching of the ligaments and muscles as the pregnancy advances, as the baby is growing bigger and bigger. And second, it puts pressure on the nerves and vessels, because of which also you can have a back pain. So what are all the treatments or what are the relief that you can have? One, you can use hot or cold compression over your back, which can give some kind of relief. Second, have an exercise routine, some stretches and some basic workouts every single day, such that it reduces the back pain or prevents the back pain. Number three, you can take mild painkillers like paracetamol, maybe once or twice whenever you have pain. But if you are trying to take it regular, that also is harmful. So you can consult your gynecologist before taking. But mild painkiller like paracetamol only once a time, it's totally fine. So the second portion of it, what are all the myths related to pregnancy? Should you eat for two? No, that's an absolute myth. Should you not sleep on your back? No, it's not like that. Till 14 or 16 weeks, you can very well lie on your back. That's completely fine. But after 14 or 16 weeks, during your second trimester, the uterus starts growing bigger and bigger, because of which the pressure of the uterus can fall back on the nerves on the back side or blood vessels on the back. So it is advisable to sleep on either sides, not just on the left side, but on either side for the maximum duration. You can still sleep or lie on the back for few minutes, which is completely alright. But try avoiding sleeping on the back for longer durations. Number three, can I consume black grapes, black dates during the pregnancy? Will it lead to darkness or dark colored baby? It's an absolute myth. You can very well take dark grapes or dark dates during the pregnancy, because that is the richest source of iron and it's going to help you improve the hemoglobin, which is very good during the pregnancy. So these are some of the common myths that the women already has in her mind because of the ancestors or because of the elders in the family telling her. Okay, let's move to the third segment, which is what are all the risk factors or warning signs that the women should be alarmed of. First, Bleeding or spotting anytime during the pregnancy, definitely you have to visit your consultant. Second, abdominal pain, severe lower abdominal pain or severe back pain which is preventing you from doing your day-to-day activities, then you have to definitely visit your doctor. Any thick white discharge along with bad smell or itching, you have to visit your doctor. Bad recurrent headaches which are not settling in few time or it is coming often, then you have to visit your doctor. Giddiness, vomiting after each meal, or even if you take water, then definitely you have to visit your consultant. Decreased baby movements or zero baby movements after 24 or 26 weeks, then definitely you have to visit your doctor. Any sudden swelling in legs with facial puffiness with decreased urine output, then you have to visit your doctor. So these are some of the red flag signs or warning signs that you should be aware of, and you should visit your consultant gynecologist as soon as possible once you see any of these symptoms. The last but not the least, the mental health. The mental health is something like a missing piece of the puzzle in every pregnant woman's journey. They always underweigh the importance of mental health, but that contributes to the maximum portion of the health during pregnancy, because if something is not right inside, whatever you do to the outer beauty of you, that's not going to yield results, right? So similarly, if you are not happy inside, if you are having so much of doubts or overwhelming or anxiousness, fear inside you, whatever physical treatments you take for the physical attributes of you and the baby, for the health of you and baby, that's not going to help you reach that healthy pregnancy unless and until you work on your inner self. So try to speak out if you have any difficulties. For example, if you have any doubts and overwhelmings in your mind, please ask your doctor whenever you go for the visit. Do not keep it to yourself. Spit out all your doubts, get it clarified before you leave the hall. Number 2, ask support, ask for help, tell how you're feeling, ask the support of the elders in the family or your partner helping you to come out of the situation if you are not feeling happy. Number 3, prepare yourself. This is a long-term responsibility. I heard this quote from a doctor which is very, very beautiful and apt for pregnancy and postpartum. If you are working in an office, okay, say like an accountant, and if you are given a promotion to the manager, that new post comes with a set of additional responsibilities, right? Similarly, once the baby enters into your life, inside or outside the world, that is during your pregnancy or during the postpartum, that is like an added responsibility. This new post comes with a set of added responsibilities. Only if you are prepared for it, only if you are aware of it and trying to prepare yourself to tackle it, you're going to handle it well. If you are expecting to have a child with no added responsibilities, you're seeking the wrong train, and that's not going to happen. So prepare your inner self, how to ask support whenever you're not feeling all right, how to get your doubts clarified. Make a list of all your doubts before you go for the next visit. Ask all your doubts, be it silly or serious, it doesn't matter, but get it out of your mind. Try to spend some me time for yourself. Seek what you need, because you are changing physically and mentally. So this new me needs a lot of me time, which means you have to spend time with yourself, doing what you love, prioritizing yourself in order to have a happy you. Only a happy you can give rise to a happy baby of you. Without you understanding this, do not take the next step in your pregnancy. I hope you found this video useful. If you like this video, do like, subscribe to my channel if you haven't done already, and do share it with your friends and family who needs to watch this video today. For more such content, subscribe to my channel and hit on the notification bell icon. Also, don't forget to comment your doubts and get it clarified by me in the upcoming videos. Until I meet you in the next video, stay happy, stay mommified.